This restroom can save lives. This public bathroom is one of only a few dozen in the country that has been fitted with a new device helping prevent overdose deaths. This system, at the Boston Healthcare for the Homeless program, is located at the epicenter of New England's overdose crisis at an infamous intersection in the heart of Boston's Methadone Mile.
Mass and Cass.
Mass and Cass.
Mass and Cass. It's an area in distress that hosts the city's crisis of substance abuse, addiction, mental illness, and homelessness.
We are very clear in our rules when it comes to we don't allow drug use in the building, but by saying that doesn't necessarily is going to prevent people from using. So it's just recognizing that this is happening and what can we do to make sure that we can safely respond to the need of our patients.
The system was developed by John King, an electrician from nearby Andover, Massachusetts. He's worked with the clinic for years, but in 2016, he was approached by a facilities manager.
I'm walking through the lobby. She goes, "John, come over here." And we're standing at the lobby bathrooms. And can you figure out a way to do some type of alarm system for this bathroom in case somebody overdoses? Or I think at the time they had overdoses. And I was like, yeah, sure, I'll give it a try. So I started with the obvious, motion sensors used for lighting and stuff and different things. But I had to make it like foolproof. No matter what you did, you couldn't make a mistake.
Here's how the system works. When the bathroom is not in use, the door is left open. Once the door is closed, a motion sensor is activated. John sets up the sensors to set off an alarm not when motion is detected, but when motion stops being detected. If more than 2 minutes and 45 seconds go by without motion being detected, an alarm sounds and medical staff quickly come to check to see if an overdose is occurring.
We are constantly responding to overdoses in the bathrooms, and it's thanks to the system. So the system is allowing us to identify that there's no movement in the bathroom, and we go in. Most of the time is actually the need to help someone that is either overdosing or close to overdose.
It's like going back in time, like I invented a time machine. So the time machine gives you the 2.5 minutes or 3 minutes to bring the person back. And I'll get a call every once in a while from one of the clients and like, "John, we saved somebody today. We're so happy." And I go, "I'm glad for you," So that's rewarding to hear that,